Welcome to Adapted Class. This is part 2 of the video I made. Fundamentals of nursing is our safety. And with safety come with common sense because we don't want to cause trouble to a patient or cause harm to the patient. See what I'm going to do with these 10 questions. You will love to watch it. Let's get to it. First question, what should the nurse do first? Prioritization 101. A nurse is walking the client back to bed and the client suddenly states what? I feel dizzy. Both of you walking, all of a sudden, patient said, I feel dizzy. What do you want to do? Do you call for help so that the patient doesn't fall? Do you walk the patient back quickly so that they can have a place to sit? Do you lower the client gently to the floor so that they don't fall? Or do you ask the client what they had to eat? That's why they feel dizzy. That's taking strategy and common sense. You know safety is the right thing. If somebody is standing and they feel dizzy, the easy way is to lay them flat. So which of these answer choice is laying the patient flat? You see the content, you know. Forget about the answer choice they've given you. Think about it. I have to lay the patient flat. Calling for help, patient is still standing. Walking the client back, patient is still standing. Lowering the client gently, patient is on the floor. Ask the client what they had to eat has nothing to do with safety. Number 3 is the right answer. As you can see, lower the client gently to the floor. And that is the best answer. What is the best action? Prioritization 101. All 4 of the answer choices are good, but there's one that is the best. A nurse is preparing to give a client a bed bath. The client refuses. Patient refuses bath. What do you do? Call the charge nurse and said, my patient does not want the bath. Explain the importance and ask later. Tell them, hey, you need to bath, otherwise you're going to stink. So I'll come back and ask you again. Document the refusal, and leave the room. That means you document and you leave. Perform the bath anyways for hygiene purposes. Do you want to perform it? Do you want to perform it again if the patient refuses? Patient has autonomy. If they said they don't want it, that means you should not do it. If you do number 4, you are in trouble. If you document refusal and you leave the room, that means you've not educated the patient. They want to kill themselves. You said, okay, go ahead and kill themselves. That's the same thing. They don't want to bath. You are the nurse. You know more in terms of nursing care. Educate the patient and come back and ask again and see if they've changed their mind. So explain the importance of having a bath and ask again. Number 2. What is the next best response? That means what do you want to do? Common sense tell you a client is scheduled for surgery at 7 a.m. and want to drink at 6 a.m. That means 1 hour before surgery. What is the best thing to do in the common sense way? I'm going to have surgery. What should I do? In this situation, patient want to drink. Okay, you tell them, go ahead, little water will not hurt. Is it a good thing? You should not eat or drink before surgery, right? That's true. Let me check your pre-op instruction. That is true. You can only have juice, not water. They both liquid. Therefore, number 4 is out. Number 1 is out. But think about it. The answer choice said, the question said, best respond. Always use your prioritization common sense. He said, you should not eat or drink before surgery. Yeah, it's common sense. But that does not answer the question, right? You're just giving the fact. But let me check your pre-op instruction. Maybe you are allowed to drink something, depending. I never tell you what kind of surgery they're going to have. Critical thinking is always good, not to assume that they shouldn't eat or drink. Verify protocol, verify pre-op orders. I'm going to verify your pre-op instruction to figure out if you're allowed to drink 1 hour before surgery. There is some surgeries that you can drink up to like 1 hour before. Therefore, let me check your pre-op instruction. And that's the better answer. Number 3. A nurse finds an unlabeled medication in the client's room. What is the priority action? This is straightforward common sense. Medication is unlabeled. You know it's a medication, but you don't know what it is. What would you do? What do you want to, what do you want to do? Right? What do you want to do? So what do you want to do in this situation? What do you want to do? So the answer choice said, what? Ask the client what it is. This is a medication. Throw it away. You want to throw it away? Report it to the charge nurse. You saw the medication. Do not administer and follow facility protocol. You don't know what it is. Unlabeled medication should not be given to any patient. You can see all these questions as safety. Therefore, the best thing, asking the client what it is, they don't know. It's a medication. They don't know what it is. If you throw it away, you have not fixed the problem. Don't give it to the patient and follow facility protocol. Maybe that medication cannot just be thrown away. It may be chemo agent. It has to be disposed properly. Therefore, 4 is the right answer. A nurse enters a room where the fire alarm is sounding and smoke is visible. What is the first action? What is the first action? This is fire. This is straightforward. That common sense tell you when there's a fire, you raise. When there's a fire, you raise. That means what? You remove the individual from there, activate the alarm, contain the fire, and extinguish it. Which answer choice is removing the patient? C, remove the client from the room. Call the rapid response is calling for help. Close our door is containing it. And extinguishing the fire is extinguishing. That's E. So the first thing is to remove the individual. Number 3. The next notice the bed alarm for a 4-risk client is not on. The bed alarm for a 4-risk patient is not on. These are not hard questions. It's to test your common sense. I've given you the answer. It's a bed alarm. Patient is going to fall. And the alarm is not on. That means the patient is going to fall. What therefore you should do is to prevent the fall. Common sense, test-taking strategy, safety. Ignore it if the client is sleeping. Is the patient going to fall? Patient is going to fall. They will roll around and fall. Turn it on immediately. Notify the charge nurse. The charge nurse has nothing to do with it. Document that it was off. It does not solve the problem. Okay, I document. And so what? Always intervene. Okay, notify, then you document. Intervene in this situation. And what is the intervention? Turn it on immediately before the patient is straightforward. And this is assisting with meals, which clients should be fed first. This is test-taking strategy. 4 people want to eat. Who are you going to assist? Test-taking strategy tell you that I will assist somebody who cannot feed himself. I will assist somebody who has higher risks of aspiration. An elderly client with mild dementia, maybe they may need help. Mild dementia, they can feed themselves. A client who had stroke and coughing with liquid, tell you aspiration risks. Diabetic client with a blood sugar of 150, he has nothing to do with aspiration. A client who is on what? Regular diet and is alert, can feed himself, no risk of aspiration. Therefore, number 2 is the right answer. And as you can see, there's a theme in all these questions: test-taking strategy and safety in terms of fundamentals using common sense. And as is preparing to transfer a weak client from bed to chair, we transferring the patient from what? Bed to chair. What should the nurse do first? The patient is weak. That's the buzzword. What do you want to do first? I have a weak patient. What do I want to do first? That means I want to prevent fall. And the next thing is what? Safety. As the client, if they can do it alone. The buzzword in the question say weak. And then you are transferring them from the bed to chair. Ask them if they can do it alone. Does not help. Grab another nurse for help. That's bringing more people, right? Put on the gate belt and lock the bed, right? Put on the gate belt and lock the bed. That's safety. Number two is safety. But which one is more safety? Let the client try to stand to test the strength. 1 and 4 is garbage. It's not helping you. It's just distracting you. The patient is weak. There's a reason why there's a weak client in the question. Don't change it. Don't make it sound like you want to test their weakness. Therefore, 2 and 3 are your best answer. But which one provide more safety in terms of common sense? Calling for help, but you've not locked the bed. You don't have a gate bet on. They're going to fall. 3 is your best answer. 9, a client report, I don't understand why I'm taking this medication. Okay, throw it away. What should the nurse do? You are the nurse. Provide some medication, common sense wise. Provide education, common sense wise. Provide education, common sense wise. Say, it's already been prescribed. And so what? I don't have to take it because it's been prescribed. I ask you a question, you're supposed to answer it. Common sense nursing care. Re-explain the purpose in simple terms. It looks like I'm educating the patient. The client to ask the nurse, the doctor later. You are in charge of nursing care. You are the doctor now. Provide some education. Give a pamphlet and leave the room. That's not education. You're delegating your job to the patient. 2 is the best answer. And the last one, a client with a blood pressure of 88/52 and report feeling lightheaded. This is the same question. I change it. Question 1. Go back to question 1. And it's the person walking and feeling dizzy. Now I'm telling you the patient has a blood pressure of 88/92 and feeling lightheaded. The same thing. Hypotension, symptomatic. What position do you put it? These are kind of questions the NCLEX give you, positional question. So which position should I place this patient? Give them orange juice. I did not tell you patient is having hypoglycemia. Recheck blood pressure in an hour. Patient is having symptoms. I need to fix the hypotension. Assist the client to lay down and elevate the leg. Positioner. Answering symptomatic hypotension in the position form. Notify the provider. You can provide some position. Test taking strategy, common sense, fundamentals, safety, using common sense. Thank you for being a member. Thank you for watching. Thank you for subscribing. Good luck in your exams.